So this technique is a soft tissue release technique. It's used by sports massage therapists and is included in the level 4 course. Soft tissue release is a way of breaking down adhesion within muscles by introducing movement. In this case, we're going to do it on the hamstrings. And what we would need to do, the protocol is to apply a block into the muscles proximal to the joint that you are going to move. So we're going to move the knee joint and we're going to go into flexion and extension. So I'm going to find an area of tension, which is roughly around about here in the hamstring. We're going to release the block, shorten the muscle, take the stretch out of the muscle, apply a block, and then lengthen the muscle. The pressure should create a pain level of about 6 out of 10, so no more than a 6 or 7 out of 10. You can progress your technique from passive to passive assisted to active. You can do the technique 3 times in each protocol, but you should move distal from the joint that you are moving. So you're applying the block proximal to the joint, and then after one movement, release the block, move away from the joint that you are moving, and apply another block, and go again. Okay. For a soft tissue release, I would use my elbow. Find that area of tension. That bit's all there?
Yes.
Okay. Shorten the muscle, relax the muscle, apply your block, and then slowly lengthen. Passive assisted. So I would do that 3 times, then move on to passive assisted. Passive assisted, Pino, you're going to just take some control of your leg and just stop it from hitting the couch nice and gently, taking a little bit of action. There we go. And your client will support, your therapist supports you on your way down. Perfect. And then active, if you take control of your leg, there you go, apply my block. Perfect. Lovely. After you've done maybe 3 soft tissue release techniques, then just flush through with some effleurage and petrissage. You could also apply this technique transversely. So if I was to move the leg into internal and external rotation, you can feel the hamstring moving across your fingers here. And this would be termed as a transverse soft tissue release, and again can be done passively, passive assisted, or active. It's a little bit trickier to do for the client in the hamstrings, but if I keep the leg in a nice stretched position, find an area that needs work, and then Pino, if you could just rotate your hip inwards and outwards, so that's it, so that's an external rotation or lateral rotation, and then roll your hip inwards. There we go, good. And we're just working across the hamstring and then laterally rotate again. Lovely. Good. Flush it through with some effleurage and petrissage, and that's soft tissue release done both longitudinally and transverse.